My name is Libby McNeely, and I am going to be discussing the topic of anorexia nervosa, when being health conscious becomes more than just a diet. Body image and self-esteem are profoundly impacted by the sources we expose ourselves to every day. These sources, such as images we view on television, magazines, and the internet, as well as many other outlets, work in combination with the standards our peers and trusted alliances hold surrounding how our figures ought to look. Striving to make health-conscious choices in order to maintain a healthy body weight, particularly in a world consumed by high-calorie and low-energy food choices, seems harmless. However, when that desire distorts our self-view, obsession sets in and an eating disorder begins to develop. The media showcases an unrealistic image of what women are supposed to look like. Places like magazines, television and movies, advertisements, models, and especially social media. Social media has gradually become TV's #1 competitor in influencing young women's overall body image as it has become such a huge part of our society. Anorexia nervosa is a derivative from the Latin word meaning nervous loss of appetite and is characterized by a severe revulsion towards eating that results in extreme thinness and sometimes in death from self-inflicted starvation. Anorexia nervosa is an eating disorder in which those afflicted obsess over weight, body image, and what they eat. There are two distinct subtypes that are recognized within the diagnostics criteria. First, the restricting type is categorized primarily by an individual who maintains a low body weight purely by restricting food intake while also participating in compulsive exercise. And second, those with binge eating purging type can be categorized by their food intake restrictions. However, they are also likely to purge their bodies following a binge eating episode. According to the DSM-5 criteria, to be diagnosed as having anorexia nervosa, a person must display persistent restriction of energy intake leading to significantly low body weight in context of what is minimally expected for age, sex, developmental trajectory, and physical health. Either an intense fear of gaining weight or of becoming fat, or persistent behavior that interferes with weight gain, even though significantly low weight. Disturbances in the way one's body weight or shape is experienced, undue influence of body shape and weight on self-evaluation, or persistent lack of recognition of the seriousness of the current low body weight. Those who struggle with anorexia nervosa display both psychological and physical symptoms. Some physical symptoms of this disorder may include lethargy, lack of menarche, languor, yellowing of skin, cold intolerance, abdominal pain, and constipation. Psychological symptoms may include depressed mood, social withdrawal, irritability, insomnia, undernutrition, obsessions about food, desire to control one's environment, and restrained emotional expression. While any person has the potential to develop an eating disorder, young women are particularly at risk for becoming anorexic. While the exact cause of anorexia nervosa is unknown, many healthcare professionals and psychologists believe that a combination of biological, psychological, and environmental factors contribute to the overall development of anorexia. It is thought that those with genetic predispositions, such as a tendency toward perfectionism, sensitivity, and perseverance, are all traits associated with anorexia. Emotional and psychological characteristics have been linked to the prevalence of eating disorders, including anorexia. Most commonly debated is the impact of sociocultural influences on the development of anorexia. In modern Western culture, thinness is not only considered desirable, it is coveted and regarded as one of the main deciding factors as to if an individual is considered particularly beautiful or worthy. This culturally accepted concept of unrealistic thinness perpetuates the need for young women to achieve actress-like body images, a feat that is dangerous and generally unattainable. Coexisting mental health conditions associated with anorexia can include depression, social phobias, anxiety, bipolar disorder, post-traumatic stress disorder, obsessive-compulsive personality disorder, borderline personality disorder, sleep disorders, and substance abuse or dependence issues. Much of the treatment provided is dependent upon whether the clinician has accurately diagnosed the primary disorder. In diagnosing anorexia nervosa, body mass index is frequently used in order to determine severity of the illness. For adults with anorexia, the BMI criteria states that ranges of mild anorexia are from 17 to 17.99, moderate range of 16 to 16.99, and severe range consists of 15 to 15.99, with anything below that being categorized as severe. For treatment to be effective, medical health professionals need to create a comprehensive treatment plan that addresses all comorbid conditions, not just the symptoms of the anorexic patient. If the patient's life is in danger, hospitalization on a medical or psychiatric ward may be required. Family counseling, individual therapy, such as cognitive behavioral therapy, and medications such as antidepressants may be utilized during the course of treatment. New evidence suggests that mentoring programs that focus on improving hope may provide a valuable adjunct support for those in treatment for an eating disorder. While there are currently no medications that are approved and/or effective in the treatment of anorexia, other psychiatric medications may help improve the mental state associated with those who are experiencing an eating disorder, since issues like anxiety and depression have been found to coincide with this condition. All areas of treatment aim at restoring the patient to a healthy weight first, with long-term psychological healing being the ultimate goal. Adaptations of family support systems, as well as amending any necessary dysfunction found within the patient's innate thought processes, may prove particularly challenging during the course of treatment, as it will demand those involved to introspectively reflect on personal contributions made to the development of the afflicted person's condition, a feat that may be difficult for many to do openly. In addition to the personal work and development necessary for treatment to be effective, clinicians may differ in the approach they believe to be effective when addressing anorexia. This includes the method of treatment prescribed, such as utilizing cognitive behavioral therapy versus nutritional education and supportive programs. Having known the difficulties associated with seeking cultural acceptance, particularly with my peers, I found myself relating to much of the material presented on possible socio-cultural causes for this disorder. As a female, I have experienced the pressure to conform to meet what was considered popular in the effort to feel as though I belonged to a group. Reflecting back, it is obvious to me now that much of what I equated to happiness as an adolescent, and even as a young adult woman, was how I looked. Physical appearance ought to consist of more than just overall body size, and in my opinion, should not hold as much weight when deciding a person's value. Understanding what constitutes an eating disorder, as well as the conditions that can manifest alongside the illness, is instrumental in providing help to anyone who may be suffering from such a disease. While clinicians do not have any pharmacological remedies to address eating disorders, I believe that psychoeducation coupled with cognitive behavioral therapy techniques has a powerful impact on treating anorexia nervosa. By educating the patient, they are given the tools to utilize when symptoms surface, tools that are learned through therapeutic interventions. These interventions address all facets of the client's well-being, enabling them to live a life that is fulfilling.